everybody. If you can start grabbing your cup of coffee and finding your seat, and we'll get started here in just about 1 minute. Everyone, yes? If you haven't grabbed a cup of coffee, there's refreshments against the back wall and some snacks. If there's any students here, please don't be shy about eating all of those snacks because I don't want to take them home. Thank you, everyone, for being here today. This is an important discussion in New Hampshire, and I'm just so very grateful that you all are taking the time out of your schedule to listen to this discussion. I just want to take a quick second to give you an intro on the panelists that we have here. We have a top-notch group of panelists. My name is Sue Hamola. I'm the New Hampshire chairman of Smart Approaches to Marijuana. SAM is a nonpartisan coalition that educates lawmakers and the public on science-based marijuana policy. First and foremost, I'd like to say thank you to St. Anselm's and also to particularly Miss Ann Kamen. And I also want to give a great shout out to Celeste Clark, who this was her idea and her brainchild, and we've been working on it together, and I'm just really grateful to Celeste for her time with this. One of the things I also want to yes, thank you. I want to thank the students and the students that are present. We have a nice diverse group of people in the audience. We have students, we have state representatives, we have Senator Gannon, we have law enforcement, we have drug prevention partners, and we have members of the public. And I think that that's really important to have everyone here at the table. I'm going to give some quick introductions of our panelists. On our panelists, we actually have people who are traditionally pro and against legalization. And that's important because this is an important public discussion. Yeah. And when you have important public discussions, you need as many people at the table to come up with solutions. And you need community buy-in as well. So it's very important that we're all here today. I'm particularly grateful to everyone. Starting off, I'd like to thank moderator Kevin Landrigan. Kevin Landrigan is the senior reporter at New Hampshire Union Leader. He serves as the State House Bureau Chief. He has nearly 45 years of experience covering politics and public policy for print and broadcast media, having continuously covered the legislature since 1988. In 2020, Mr. Landrigan won a Lifetime Achievement Award from the New Hampshire Press Association for his coverage of politics and public policy. And in 2022, he won the 2022 Public Occurrence Award for his reporting. We also have panelist Amy Turncliff, PhD, neuroscientist, and public health advocate. Dr. Turncliff is the founding director of Rock Fern Scientific Consulting. She completed her postdoctoral training at Harvard Medical School with Dr. Bertha Madras, who is a leading researcher on the effects of drugs on adolescents and adult brains. Dr. Turncliff has been a scientific consultant specializing in mental health and substance use disorder for 20 years, and her primary area of focus is marijuana policy, aiming to prevent serious mental health harms caused by today's high THC products. She's also the co-founder and chair of Metro West Substance Awareness and Prevention Alliance. We also have panelist Representative Paul Berch. Paul Berch is a 6-term state representative from Westmoreland, New Hampshire. He currently serves as the ranking member of the New Hampshire House Judiciary Committee. In addition to that, he also serves as the vice chair of the Connecticut River Flood Control Commission. Representative Berch is also a retired managing attorney for the Windham County Public Defender's Office and has served as the former president of the Windham County Bar Association, the president of the Vermont Association of Criminal Defense Lawyers, and the co-chair of the Vermont ACLU legal panel. And then also, lastly, we have Dr. Kevin Sabet. As you know, Dr. Sabet is the founder of Smart Approaches to Marijuana. He has served as a drug policy advisor to Presidents Clinton, Bush, and Obama. He writes a regular column on drug policy for Newsweek and is a fellow at Yale University. He's also an author, as we discussed earlier. His most recent book will be coming out in November, One Nation Under the Influence. We have, each panelist will give just a few minutes of a brief introduction, and then we'll go straight into our moderated discussion. Thank you.
So, did one of you want to, did you want one of them to speak, or should I just start asking questions?
Amy, do you want to give Dr. Turncliff, do you want to give a brief intro, if you like?
Your argument in 1 minute.
Sure. Thank you so much for having me. It is a very important conversation, and this is a state that I love deeply, even though I came from Massachusetts this morning. My heart really is in New Hampshire, so I appreciate this conversation. I think we were told we had an opportunity to say where we landed with marijuana policy. And I mentioned to Sue that my perspective that you'll hear today is really first and foremost based on my work as a neuroscientist and public health advocate for more than 20 years. So everything you will hear me say today is through that lens, and also as the parent of 3 teenagers, 18, 16, and 13. So I'm in it. So for those of you who also are parenting teens right now, it's fun times. But it really is fun times because most young people are choosing not to use substances, right? And so we should celebrate that and celebrate them. But I don't support marijuana legalization. And it is for the reasons I just said, for really to promote behavioral health promotion. And we now know that today's high THC products are contributing to serious and severe mental health disorders, including psychosis, addiction, and suicide. And then really kind of my area where I spend a lot of time is schizophrenia. When I was an undergraduate student focusing on psychology and biology, because there was no neuroscience at that time, we learned that schizophrenia wasn't preventable. We didn't know who would develop schizophrenia. We didn't know how we could alter the course of someone's life such that they wouldn't develop this very severe mental health disorder. We now know that THC use, today's products in particular, are an independent modifiable risk factor for serious mental illness, including schizophrenia and bipolar disorder. To me, right there, that's enough to oppose legalization. We know that with legalization comes normalization, which then leads to what we're seeing now, and I'm sure we'll talk about an increase in heavy use. So,
sure. As a legislator on Judiciary Committee, we somewhat get involved in this policy, though it tends to be in the Criminal Justice Committee. But my views are more fashioned, as was referenced. I was Vermont Senior Public Defender. My area as managing attorney of an office was adjacent to Interstate 91, which is a major drug distribution route for drugs coming up from more southern states. And the first stop was in Brattleboro, Vermont. And so I've spent 35 years talking with law enforcement on a virtual daily basis, talking with judges, talking with prosecutors, talking with social workers, talking with users, talking with defendants and the like. That fashions my strong position in favor of legalization. I think, and you're going to hear a variety of this statement throughout the discussion this morning, that to me, and I think to many, the argument about should we keep prohibition, that's done. That's last week's argument or last year's argument. The facts on the ground indicate that that's not the war that needs to be fought or the battle needs to be fought. I think organizations such as this, experts that are on both sides of me, should be, hopefully, in the discussion of, and this was the tail end of your remarks, is given what the situation is, what should responses be, especially in terms of legalization here? Should it be a matter of anybody can sell anything, the so-called libertarian model? Should it be full state control, like state liquor stores and the like? Should it be state regulate as to potency and purity, and yet have private entrepreneurs subject to that, sell it? And those are important questions, or valuable questions. People in this room have answers to that, as well as what social services should there be that go along with a recognition that anybody in New Hampshire who wants to get pot that's already regulated as to potency and purity can do it easily. I live on the border of New Hampshire, Vermont, and Massachusetts. From where I live, I could go to a dispensary in Brattleboro, Vermont in about 8 minutes and buy whatever I want. If I wanted to go to Massachusetts, it would take me 15 minutes, and I could buy whatever I want. So the argument to me about legalization is the wrong argument. The answer is, given our youth can get it, our adults can get it without any trouble whatsoever, how can we take care of whatever issues are identified with that use?
Great, sure. You know, I want to thank the fellow panelists for being here. Representative Berch, especially you. You're here flanked by the. It's usually the position I'm in, outnumbered. Some of you know I went to Berkeley, and we had a group called Citizens for a Drug-Free Berkeley. It was about as popular as the Coalition for a Wine-Free France. So I know what it's like to be outnumbered. So I appreciate you being here in the spirit of discussion, which is something that we just don't do as much in this country. We don't talk to each other anymore. We resort to incredible violence and intimidation, and it's just a shame. So I want to again thank St. A's for hosting this. Appreciate it, everybody that's here. You know, my position is clearly that, I mean, you heard it from before, but I want to restate it, that I think we have a false dichotomy set up between criminalization and sort of commercialized legalization. On the other hand, I don't think either is favorable. I agree with Representative Berch. If you want to get marijuana now, you can. For me, that's an argument of why would you then want to commercialize it? Because when I, you know, again, when I sit on these panels, usually it's sort of a Berkeley-type hippie to my left and a Wall Street investor on my right, who are agreeing, ironically, on this, even though the hippie hates corporate America and corporate America sort of hates hippies. But they're together on this because there's money to be made. And when there's money to be made in the addiction business, watch out. And that is what I think this is about. You can get it now. I mean, if you're a libertarian and want to smoke weed on your farm all day on a Sunday, and that's not my concern. My concern is that in every single state that has done this, and now we have the examples, you see how it's been massively commercialized, how, first of all, it's not about social justice at all, because there are not people in prison for low-level marijuana use, and if there were, we would have a massive exiting of prison in California, Colorado, and 35 other states. We haven't had that. Also, in New York, the argument was made that social justice, this can sort of help people harmed by the war on drugs. The people making money are guys that look like me, let's be honest. They're the Wall Street investors. They don't use marijuana, the ones that are making money. The tobacco industry and those that are under 30, and there's a few of you, we used to live in a world where when you went to the restaurant, the first question wasn't, do you have a reservation? The first question was, smoking or non? When you bought an airplane ticket, the first question was smoking or non, and you would get on an airplane, and there would be row 7 to 5 was smoking, and rows 8 to the other ones were non-smoking. And for some reason, you were supposed to be protected up there. But that was kind of the logic, because we put profits over public health, which we have a very good sense of doing in this country, about everything. And the idea that this is going to be the one time when we're going to get it right, where the one time, and New Hampshire is going to be the one state, and I've heard it everywhere, where you're going to do it differently. You're going to do it the state model. You're going to do it the social justice model. I've heard that everywhere. And it doesn't turn out that way. So I don't think we should arrest people, throw them in prison. I think we should not give criminal records. We should expunge records. We went overboard at one point in our drug policy history. I'm the first to admit that. But I don't think that's an argument to go what I would argue is radically on the other side of it either.
Well, great. Now you understand why, as moderator, I wish I'd slept in a Holiday Inn. If I had, I'd feel I have the same intellectual firepower as you've heard on this panel. Hopefully I can help facilitate this discussion. I look forward to doing that. With each question, I want all of you to have the opportunity to answer, but I'm going to alternate who should take it first. Since this was all about legalization and public safety, what evidence from other states exists that inform us about the impact of legalizing marijuana regarding traffic on the highways? Since many advocates of legalization insist those high on pot drive slower and are less aggressive than those who are intoxicated from alcohol. Dr. Sabet.
Well, I think one thing to premise this answer with, and actually it's good because it should really premise every answer, is we're not talking about marijuana that maybe most people in this room are familiar with. We're not talking about marijuana grown outdoors. They called it weed for a reason because it grows like a weed, very easy to grow, very easy plant to grow, and has low levels naturally of THC. They're not very high. Today's marijuana that we're talking about, especially in these legal states where there's absolutely no regulation, and anybody that tells you that they know what they're getting and there's limits, they don't know what they're talking about because the labs have no idea. It's not federally legal. There's no FDA-approved labs. No one knows what's in it. What we do know is that the THC level, which is the one ingredient in marijuana that binds to certain receptors that make you high, that THC level is off the charts today. So in terms of driving slower and whatnot, today's THC is actually producing, I would argue, and Dr. Turncliff can maybe speak to this and correct me, is producing outcomes that are completely counterintuitive to what Woodstock weed would do. So it's not making you a slower driver, it's actually making you a more aggressive driver in many ways. The latest studies on driving show speeding, they show aggression. Now, of course, it's lack of ability for depth perception, definite lack of motor skills and coordination and reaction time. I mean, that's obvious. With anyone that you've seen high, the reaction time usually isn't super fast. That's important when you drive. So those things are big. And so in those states, it's not surprising, and it's not me. You shouldn't just take my word for it. You should look these up. When you talk to AAA, you talk to the insurance companies, you talk to public safety groups, you talk to Mothers Against Drunk Driving, they're seeing now marijuana at rates that they've never seen before in states like Colorado, where 1 in 4 deadly crashes involves marijuana. It's never like that before. Washington State, 50% increase. And some people say, well, how do you know it was marijuana, Kevin, recent use? Because if you test, it can be in your urine for 30 days. And the reality is the vast majority of these tests are now oral tests. Oral tests can detect recent use. You cannot use the argument that, I didn't use it, it was 3 weeks ago, I promise, when it's an oral test. And when you're also able to do other kinds of behavioral testing that these law enforcement officers, I'm guessing, in this room do, which are drug recognition experts, they can test with certain behavioral markers. So we do know about recent use. We do know about when marijuana is some contributory factor. You can never say it's the only factor. And in those states, it's not surprising because there's been such a large volume of increase in use, especially among adults, by the way. And even older adults are using it in a way they've never had before because it's so accessible. We're seeing the driving impacts.
Representative Berch, any thoughts on that?
Okay. Since we're not supposed to interrupt, I didn't. But notice the words involves marijuana and contributory to marijuana. I don't know the studies that have shown the causation of the accident caused by the marijuana usage, as opposed to somebody who perhaps has gotten into an accident and they do a blood test eventually or whatever, and they discover marijuana in the system. So I'm just not sure what involved marijuana or contributory to marijuana really means or adds. There's no question that some people drive having smoked pot. The studies I show that about 4.5% of Americans report that they've done that at least once. It's not a good thing. Nobody's in favor of it. I think, to draw back to what we were talking about earlier, is to the extent that that's a problem, and I think it is, like driving under any substance is a problem. The question is, what can we effectively do about it? One thing is public education. Remember when we all learned that don't go swimming for 3 hours after you eat? You know, unless you know how accurate that is, perhaps somebody can tell me. But we certainly learned, you know, growing up, don't go swimming right after you had your lunch. And public education is going to be a factor with public education about smoking in general. You know, has had a major impact on usage of marijuana. Marijuana prohibition, it doesn't address the problem. People who have it are going to smoke if they think it's not a problem and go driving, or they won't. And yes, the simple testing is, as Kevin has said, is a bit difficult because it stays in the body for 30 days. So simply showing it was in the body, you could have smoked a joint, 20 days earlier or something like that, and that doesn't mean it affected your driving on that day. The general question about the potency is, I think, a really important question, because there's no question that the usage, the marijuana that's commonly available, shall we say, other than your neighbor growing it and giving you some, is of a higher potency. There's no question about it. But again, that goes to the question of, if we're going to have marijuana regulated or legalized, how do we go about doing it? So if I go, and this is my assumption, if I go to Brattleboro and buy marijuana at the dispensary, either in a joint form or in a gummy, it's going to be regulated, as to purity, so that we don't get the equivalent of bathtub gin when there was prohibition against alcohol, and we don't get fentanyl in the marijuana, or, to date myself, PCP, because that goes back a ways. We don't hear about that now, but fentanyl. So we regulate it and make sure it's pure, and we regulate it as to potency. If you go get some gummies, it will list on the container exactly how much THC is in the gummy you buy. And that's regulated by the state of Massachusetts or the state of New York or Vermont. And you can buy it with this percent of THC, this percent, this, whatever your desire is. So that's the benefit. One of the strong benefits of legalization is that you can regulate as to potency and purity. And what goes on now, you don't have that regulation unless you go to a store that sells it.
Amy, what about you? You live in a state, obviously, that has legalization, and
Yeah.
I've seen issues regarding accidents on the highways. What
Yeah.
kind of data can we inform the public about it?
So Massachusetts hasn't done a great job of collecting data and releasing data to the public. I mean, and I ask for data all of the time. So that's Massachusetts. Colorado, I think, has done a better job. And I just want to reiterate that and state that THC is unlike alcohol in the way it's processed by the body, right? So alcohol is water soluble. It's very predictable in the way in which it is eliminated from the body, broken down and eliminated from the body. THC is fat soluble. So when THC is consumed, if it's consumed regularly, it accumulates in the body, and we said it can stay for 30 days. It actually, in regular heavy users, can be in the body for up to 6 months after they stop using. So there's that aspect. So it accumulates kind of in the areas that have more fat. And the brain is one of the areas of the body that has the highest fat content. So in fact, even if you were to take a blood test for THC, there have been studies shown that the brain concentration of THC is higher than the blood concentration, just by nature of it liking fat. So I think that's very important. And to me, again, I think legalization should be a non-starter until we actually can measure impairment and relate it back. I mean, to your point, Representative Berch, I think you can't, talk about causation because we can't measure it. We can't measure THC, and it's highly variable in terms of what level of THC induces impairment in each individual because of the way in which they break down, their body breaks down THC. The only other thing I'd like to say is about Colorado. I mentioned they have done a better job. I think they've said it doubles using THC, has doubled the risk of accidents. And the Colorado Department of Transportation and the Colorado Department of Public Health have both issued statements saying if you have consumed, smoked, less than 35 milligrams of THC, you need to wait 6 hours before driving. If you've consumed more than 35 milligrams, you need to wait more than that. If you have eaten, so if you ingest by kind of mouth, edibles, then you need to wait 8 hours. So to me, who waits that long, right? And just so you know, in legal states, in Colorado, Massachusetts, a standard joint now contains about 60 to 110 milligrams of THC. So, back in, as we were talking about back in the Woodstock days, right? A standard joint was 10 milligrams or less of THC, and it was often shared by multiple people. So we really are talking about high levels of THC that are much more likely to cause impairment.
Representative Berch, we'll start with you with this one. What are the best reasons to legalize cannabis?
Okay, so we're supposed to keep our answers fairly short, so I try to write a list. And figure I could go through it quicker that way.
Long list.
It is. So I'll run it through quickly. 1, the battle is already over. The people have spoken. They want it. Most Americans now live in states that where recreational and medical is legal. The Granite State poll, the last one I saw, 70% of Granite Staters support legalization. You can't get 70% of Granite Staters to agree on anything except marijuana should be legal and yay Red Sox, bad Yankees. That's about it for 70% in this state. And it's gone up. 2023 was 72%, 2024, 65%, then 2025 was 70%. I could argue, though I'll get some pushback, that it's essentially, mostly, pretty much, essentially harmless. And I know there'll be pushback on that. But even if it's not considered harmless, we make decisions about taking drugs that are harmful. I had a kidney transplant. I take tacrolimus. You can take a look at the side effects. It's massive, and I do it. But think about people who have cancer, and they have decisions to make. Should they take chemo? Should they take radiation, both of which are poisons? Or should they not and just live out their natural life? People make those decisions all the time. You can make that decision about alcohol. I'm not sure I'll hear an argument that marijuana is worse than alcohol or worse than tobacco. Yet those are legal and people can make their decisions. Public safety. It reduces harm from criminalization. And there are harms when kids are dragged through, even if they don't go to jail, even if they don't, if they go to drug diversion or, pay a fine, or they're told if you rat out a couple of people, you we'll make this charge go away to somebody who doesn't know otherwise. Legal markets reduce the risk of laced or unsafe products. There's medical benefits for treating chronic pain, nausea, and the like. It allows law enforcement to focus on resources and effort on more serious, shall we say, offenses, tax revenue, job creation, cost savings to courts and to law enforcement, economic stimulus, reduces disparity, racial disparity in the criminal justice system, and finally, I'll just say, in this state, live free or die.
Did you want to respond to any
Oh,
of that?
sure, yeah. I might need to refer to your
Dr.
list
Sabet.
because I don't have a list. My wife makes my lists for us, and I usually don't do that, so I
In the
forget.
spirit of this forum,
So yes,
happy to do
let's
it.
go down the list quickly. It won't be, this is like life's work here, so we'll keep it in like 2.5 minutes. 30 years of work. So number one, public opinion. So when you actually do polls that separate the issue of medical marijuana, decriminalization, legalization, and criminalization, support for a legal commercial model where there's a marijuana store in your community, which is what we're saying, and whether and whatnot, or near your community, is definitely not 70%. It's not 70% in New Hampshire. We've done many polls. For example, look at Emerson College near in Massachusetts. They do a poll where they actually split it up. Interestingly, the recent Gallup poll, which is looking at this, in the last 4 years or 3 years, has shown a movement away from people saying that marijuana has a positive effect on the individual or society. I think that's actually a result of having legalized it in so many places, as people are actually seeing some of the negative effects. So that number is actually changing. But obviously, I mean, if I could do a poll and ask you if everybody liked, raw goat liver for lunch, and you would think no, but if I asked it a certain way, I could get 70% of you to figure out a way to say yes. So with polls, buyer beware, look at the fine print of the poll, exactly what it's asking. I will not even comment on the harmless part of it, because I think what we're learning, what the medical literature, what every single medical association in this country has said, is very clear that today's marijuana, stronger than ever before, has a direct causation to psychosis, schizophrenia, now violence in a way that you could not say violence 15 years ago. ERs in terms of the accidental poisonings. If you don't believe me, watch the first episode of Emmy Award-winning show The Pit, and you'll see what happened in the ER with the 4-year-old who got in his dad's gummies. This is happening tens of thousands of times every year in our country because this stuff is harmful. Harm from criminalization, I'm not arguing for criminalization. So again, I think that's a false choice. You can remove criminal penalties. I think if you're a young person and you're using before 21 or 25, absolutely you should go to a diversion program, some kind of educational program in some way that could be helpful. Medical benefit, I have no problem with the correct medical uses of the components of marijuana, but we should treat it like we do every other medication. Every other medication goes through a process in our scientific process, and they can be prescribed by a pharmacist and dispensed at your local pharmacy. We do not have Advil dispensaries in this country. We do not have Tylenol shops where you can get gummies, only Tylenol, but 1,000 different kinds of Tylenol, including hot waxes and dabs. That doesn't make any sense. The medical side was a total ruse, and it was very clearly laid out by the legalization, very smartly laid out by the legalization movement as a way to soften Americans' image about marijuana. Because if it's harmful, if it's healthy, how can it be harmful? And it was a very good strategy. But the reality is, I have no problem. And you know what? If you have 6 months to live, and it's a terminal illness, you could use methamphetamine if you want. You do use fentanyl. We use that for that. There's no problem with it. But this issue of, let's call it what it is, issue of these dispensaries is a joke. Treat it like a medicine. Have it go through the process. I don't think any law enforcement member, please correct me if I'm wrong, in here says that because marijuana is technically illegal in New Hampshire, you're focusing on it and you're not able to focus on serious crimes. I've never seen that happen. Tax revenue, it's about 0.01% of the total budgets of any state that's legalized. It is a drop in the bucket, and it doesn't pay for the costs. Every serious car crash is $1 million per person in lost social costs. One person in one car crash. So times that by how many? And that's only car. We're not talking about missed days of school and work. We're not talking about other kind of involvement with other issues. Yes, it's created jobs. I agree with that because you've created an industry. Every industry does that. Thank you. I would argue the racial disparity in the criminal justice system is absolutely, we have a racial disparity, but it's not because of marijuana. It's because of a lot of other reasons that we should get into. But there's actually more young black people arrested today in Colorado than there was before marijuana legalization. So marijuana legalization has nothing to do with that, and we should look at that. Finally, live free or die is a very good one, but it doesn't work, because if you want to live free or die and you want to be a libertarian, you don't want the state to grow bigger. And I promise you, when you legalize drugs, you expand the social welfare net in a way that you would not want to do, because we're not going to ignore increased addiction. We're not going to ignore increased child endangerment. No one's going to do that, even in the live free or die. We're going to have state involvement. And when you legalize any of these drugs, you are opening up, frankly, more government involvement. And sorry, finally, you mentioned alcohol, and I have to mention that because people talk about alcohol. You wouldn't prohibit alcohol. Alcohol is not legal because it's good for you. It's not legal because families say, man, if only more people in my family drank, or if only more people in this neighborhood drank, we'd be a better neighborhood. Alcohol is legal because it's been in our culture since before the Old Testament. That's why it's legal. It's a cultural, Western civilization cultural staple, and we pay dearly for it. It's the #1 reason why young black people are in the criminal justice system. Not crack, not fentanyl, not marijuana, alcohol. It's the #1 cause of violence. It's the #1 cause of domestic. We're not doing very well with alcohol, folks. And so if your headlights are broken, we don't break our taillights just to be consistent. We try and fix that. And we have a very hard time fixing alcohol because we have a massive industry that relies on heavy drinking, that wants people to drink, that likes these things because it makes them money. The idea that we would ever model anything that we can create after that is a very bad idea. I overspoke, so I will yield the rest of my time for the day. Thank you.
No, you can't yield. Yeah,
Go.
that's your time. So Dr. Sabet touched on, the list. So what I'd like to say is, I'm good, thank you. As a summary on that is that I don't think there's any benefit of legalization that cannot be addressed by alternative policy measures. I don't think you need to legalize to address the list. That's all I'm going to say on that. What I would like to say is, to me, submitting to legalization, and I want to commend New Hampshire for really continuing to have this conversation and not jumping in to follow the rest of the New England states, who really are feeling the pain on that right now. And I talk to parents every day who are struggling with loved ones with preventable major mental illness. So I'm coming in here a little angry today. I'm sorry. It's been a rough week. But submitting and going along with what the rest of your neighbors have done, I think, is to say that prevention doesn't work. We're going to give up on prevention here. In a way, I understand prevention will continue, but our policies are our best prevention. So if you choose to legalize here, you have now just given up your best prevention. And I'm going to urge you not to do that, and to hold out, and to believe in primary prevention, which is preventing substance use, youth substance use, use in our young adults for as very long as you can, because that is what works in prevention.
Great. Since the legalization trend in the U.S., the number of states adopting this is a relatively recent phenomenon. Do we really have enough scientific data to tell us what the adverse public health outcomes that could occur if it became legal here? We'll start with you, Amy.
Yeah.
That's your bailiwick.
It is. So I do want to say that, yes, legalization is relatively new. Marijuana, THC use is not. But the product has changed. Yeah. So that's really the crux of it. So we have centuries of data showing what marijuana use, THC use can do. And in the early days, it was more about people who were overusing, right? Because if you're just using very small, people microdosing, using small amounts of THC, they're they're probably just chilling, right? But people have been overusing. There have been individuals who have overused over time, and they did develop psychosis, right? They did develop addiction. They developed a lot of what we are now seeing borne out in legal states. So we've known that for centuries, that was a possibility, but with legalization, with commercialization, has come more high THC products, right? We now have products that are nearly 100% THC. And so if someone buys a gram of something that's, we'll call it 99% THC, that's 990 milligrams of THC, when a NIDA, which is National Institute on Drug Abuse, defined dose unit is 5 milligrams, right? So I'm very convinced that the people who are responsible for regulating in legal states do not understand the math, because it really, when you really get into the numbers, it's very clear, right? So we have centuries of data, so back hundreds of years. We now have decades of data showing very clear risk of harm. And more recently, in the last 10 years with legalization, we're getting data from legal states, from other countries. Canada's doing a great job of monitoring the data, all showing increased cardiovascular risk, increased mental health risk, increased addiction, increased heavy daily use, right? And so we know that it's very clear. I mentioned that we now know THC is an independent modifiable risk factor for schizophrenia, and that data is among the clearest data that we have linking THC marijuana use to the harms.
Representative Berch, any response, thoughts?
Okay, a couple of responses. First, on the revenue, by the way, the state of Massachusetts, as I understand it, takes in several $1 billion a year just on the tax revenue from sale of marijuana in their regulated stores. It's not a small amount, it's a huge amount.
Relative to the...
So, well, relative or not, that's New Hampshire money going into Massachusetts coffers. And we have that discussion about gambling. We have that discussion on a number of issues about whether our citizens who want to do certain entertainments, shall we say, spend their money on those entertainments in other states that get the money from our citizens. As to prevention in our neighbors, I have difficulty understanding how the prevention model works when from my house I can go over to Brattleboro if I wish in 5 minutes by what I want to. So talking about prevention in the abstract instead of the facts on the ground, when this country tried to do prohibition of alcohol, it was national. You couldn't go to Vermont and get it. You couldn't go to Massachusetts and get it. So it's much more a prevention issue. We're not even in that universe. We're in the universe of, does prevention work when anybody can get it whenever they want to? And that's just a whole different conversation. When we talk about the high dosages, I agree it's a problem. I don't know of any place that regulates it near us, and I don't have a whole lot of information. I stopped into a couple dispensaries. Nobody is selling 100% THC. And we talk about how much THC is in a joint. Well, do we also figure out that people smoke less of a joint each time they do it because it's more potent and they get the effect that they want with 2 puffs instead of smoking the whole thing? There's a lot of variables that I think need to be addressed. On the issue of how long it's been, because your question was about the recent efforts for legalization. Throughout history, and I'll grant you the beer as being as old as civilization, and marijuana is not much behind it. The earliest evidence dates back to about 10,000 to 12,000 years ago in China when it was cultivated. Medical use started about 2,700 years ago. Again, in China, there's a pharmacopoeia that's been found from some emperor that discusses that. In real life, it was legal in the U.S., for a long period of time, colonial times, and 17th century, 18th century, a good part of the 19th century, until it became illegal in the U.S. in 1937 under the passage of the Marijuana Tax Act. Prior to that, it was perfectly legal. And it was met with the usual uproar. And in 1939, that's 2 years later, Mayor LaGuardia had a study committee by the New York Academy of Medicine to study the health effects and regulation of cannabis. It didn't report until 1944, and it questioned the federal government's claims that marijuana was addictive and had a gateway drug effect to stronger narcotics. So that's been debated and researched, since 1944. It's not recent. I'm somewhat of a product of the 60s. I'm a little old. And there were certainly pushes for legalization back then. By my guess, that's got to be at least 50 years ago or thereabouts. So in real life, the prohibition has been a small sliver in time for that plant. And as you say about alcohol, there's a cultural aspect that has led to its continued legalization. It was also a revolt by the public against prohibition, and because the public simply didn't stand for it. Now, the same cultural aspect of marijuana, which has been around for those 10,000 years and people getting high for 2,700 years, that same cultural aspect, and you could talk about other drugs in terms of religious usage, peyote comes to mind and things like that, but marijuana is part of cultural usage that's been around far, far longer than the thin sliver of time of prohibition, and we can tell now that prohibition is losing in state after state after state, such that most Americans now live where it's legal. I was puzzled a little bit because I'm not sure of your position. I'm not sure if you were against legalization or didn't have a problem given the criminal justice aspect, which you said you didn't support. So considering legalization is basically to put the criminal justice system involved, I don't have a quarrel with other social services, counselors, doctors, whoever involved in dealing with the social problem to the extent it exists of any substance, including marijuana. I question the use of whether using the criminal justice law enforcement model against, presumably, the 55 million Americans that use it on a regular basis makes any sense. So perhaps you might clarify that during your time.
Sure. Yeah, so just to clarify that part, and then we can have a historical argument, which I'm excited to talk about. But apologies in advance. But on that part of it, what I'm saying is, yes, actually, thank you. There's a difference between decriminalization and legalization, is what I'm saying, right? So we can remove criminal penalties, not put people in jail without the legalizing aspect. The only real legalized model in this country for marijuana that we have is a commercial legalized, that's been implemented, is a commercialized model similar to alcohol or in some ways tobacco, but actually I would say tobacco is even much tighter regulated. So there's a difference there. just there were a lot of things that were said, if I can remember all of them, but the aspect about history is I definitely take issue with that. It's very, very different than alcohol. Yes, marijuana was used. Also, you forgot the Egyptians, you forgot the hashish in the Middle East, the wars that were fought over
I
this.
only had 3 minutes.
Yeah, I know. Yes, you couldn't put all that. So I agree that, yes, I mean, in isolated cultures, in certain, and at that time, very isolated cultures, in certain parts of their history, marijuana comes up. But there's 2 huge caveats with that. One, unlike alcohol, not by the vast majority of civilization. I mean, we're talking alcohol's history is the vast majority of people, including during alcohol prohibition, which alcohol was not actually prohibited during prohibition. It's a misnomer. It was decriminalized. You could drink as much as you wanted. You just couldn't buy it. Very, very different than a total blanket prohibition. And it was very rarely enforced, badly enforced. There's a whole history of alcohol prohibition we won't necessarily get into. Alcohol prohibition, though, by the way, was repealed because of taxes. They thought we can get tax revenue from alcohol. We will not have to have an income tax. That was to prevent the income tax. That didn't work out very well, as I'm reminded every April 15th. But the point of alcohol prohibition was the vast majority of people in this country were regularly using alcohol, over 70%. So to prohibit or decriminalize, or say you couldn't buy it, something that 70-some% of people were doing, that was like trying to prohibit jaywalking in Manhattan. They tried to do that, but 95% of people were doing it. So you couldn't do it. You had to modify the law. Very different than marijuana today. Even today, with the use levels skyrocketing, with heavy use off the charts, 50% of people who use marijuana in the last month use it every day. 10% of drinkers who drank in the last month use it every day. That speaks to the cultural difference right now, and it speaks to the addictive nature, I would argue, of today's THC versus even alcohol. The point of that is that the vast majority of people during Prohibition and for the last 7,000 years in Western civilization, the vast majority drink alcohol, have drunk alcohol. Very, very different than marijuana with these isolated cases in culture. In fact, that's why marijuana was always the counterculture thing. That's why Berkeley was all about it in the 60s, because it was what the man wasn't doing. And so that's why it was always against culture. So now, of course, with legalization, we're bringing in culture. It's being much more mainstreamed. I agree with you that we have a sort of bipolar policy where we have a federal law that's against marijuana. In fact, any state actor selling marijuana, issuing any license to anybody is committing multiple federal felonies on a regular basis. So that's what's happening in Vermont and Massachusetts. They are breaking multiple federal laws with regards to the financial system, with regards to trade, you could name every bureau in the federal government, they're breaking a law when they do it. It's not being enforced, and you're right, we have a policy where it's supposed to be legal, and it's not legal here, but you can drive 8 miles. I agree with you that something should be done. We might disagree with what that answer should be. I don't think there should be federal legalization. I think that would be even worse than the policy we have now, because it would open the doors to financial markets. The hedge fund managers, the Wall Street investors, the overseas investors, not to mention the underground mafia. We have not talked about the criminal aspect. They are chomping at the bit for us to open up our U.S. financial system, our banking system. They've already, the Chinese government is complicit in rural marijuana growing in places like Maine, I'm sure in places like Vermont, in rural New England, in Oklahoma. Forget about, it's striking to see the influence of Russian and mainly Chinese mafia in legal marijuana states. And this goes back to another issue that also you keep referring to, or we keep assuming, which is what's in your thing. When you read the label, you know how much THC is in it, you know what the dosage is. We don't know any of it. It's a total shot in the dark. The labs, as I put in the book, I did my own investigation, but other people have too. The labs are essentially bought by the industry because none of them are federally regulated. Now, again, you might argue that's another argument to federally regulate. And there are arguments for that because the state system is so bad that you could, even from a public health point of view, say, well, if you are going to legalize it, maybe do so on the federal level so we could have some real guidelines and teeth around it. Again, I'm still not in favor of that.
Oh,
yeah, sorry, no, too early. I'm not in favor of that because I don't have faith we're going to be able to do that well. When I lived in Washington, worked there, when I see the influence of lobbyists, when I see the alcohol industry having 4 to 6 lobbyists for every member of Congress, when I see that the illegal marijuana industry has essentially bought K Street today, bought almost every former representative or senator from either side of the aisle, paying a monthly retainer so they say good things about weed when they go to a fundraiser for the president. When I see that influence and the corrupt money that's in politics, I don't have much faith that, now if it was just up to you, Representative, and up to a couple of academics here at St. A's, and up to a couple of academics that I have healthy disagreements with, and you all got in a room and said we want to protect kids, but we want to give adults the ability to buy marijuana, I might have a less of a problem with it. Because I know you're not coming at it from that perspective of the Wall Street investor. But the reality, again, you're talking about reality on the ground. The reality on the ground is that this comes down to what we call addiction for profit. It's the same playbook as big tobacco. It's the same playbook as big sugar. It's the same playbook as big pharma and OxyContin. You exploit and expose the weakest in society for your own financial gain. And the idea that we're going to be able to put guardrails, that we're going to be able to put levels of THC, and you can know what you're getting, and we'll limit it so it's not 99%, it'll be 20%. I don't really have faith we can do that.
One quick disclaimer. I've not gotten a dime from any.
No, I know that. I can tell. That's why I said I would have
person in the
faith
weed
in you.
industry.
I know, and you should be
don't
commended.
belong to any.
And you should be commended for that. But unfortunately, it's a breed we don't see as much anymore.
You know, Dr. Sabet, there are legislators in the audience here today. I think one of the things even supporters and opponents struggle with is if we go to legalization, are there ways that the state could mitigate or limit the societal costs? Are there examples of states we see right now that are actually making efforts to do that in America?
Well, there are examples on paper. They're not examples in practice. So yes, there are other models. Rand, the very smart people, much smarter than me, for sure, at Rand Corporation and Bo Kilmer's work and John Calkin, they've looked at this and said, well, what if you had a state-owned thing where you limit the advertising? Or what if you have a nonprofit model? There's 8 or 9 different models. My response to that is, that's great. Maybe you can get it past the first, like in the beginning as the starter model. I promise that's not the model you will end with. And we can look at way Washington State regulated liquor forever on a state level. And then Costco is from Kirkland, Washington, Kirkland brand. And Costco said, we need to make more money. We have to sell liquor, but we're not allowed. But maybe we can change the law. So all Costco did was run a ballot campaign in the state of Washington. And I love Costco, but it was full of misinformation. And they were able to convince, and Washingtonians are some of the smartest people in the country, if you look at no offense to anybody here, but if you look at the degrees and all that, 51% of Washingtonians bought Costco's argument. And that 51-49 ballot initiative over a decade ago privatized liquor in Washington State because of one corporation, Costco, that wanted to sell it. So I don't have faith that even if you do the best model, which you could figure out one that would mitigate, you could say no advertising, limit THC, the state will sell it, plain packaging, limited stores. I mean, there are a lot of things. And in legal states, by the way, I work for, I'm not ignoring reality. Our organization actually works to limit THC. We do, but we are outgunned at every turn. We're not successful in that, because of the lobbyist influence, the industry influence, and after a year or two, I promise those good faith legislators that said, you know what, I don't really like it, but I guess if we could do it the right way. You had a certain governor who did that. I will not name names, who I know personally and really like, who was totally against it, and then all of a sudden got convinced that there was maybe a way that we could do it the right way. And I'm happy that that didn't work, because I promise today we would be arguing with other legislators about how, that state model, oof, we tried it, but, we can't get it to work. We gotta look at these other commercial models, and that's what I worry about.
Representative Berch, any thoughts on that?
Yeah. It seems that you're presenting a false either or.
Okay.
Because you say, because you don't have a solution that you think is an optimal solution to take care of the problem, therefore we should keep it as it is. I think that mischaracterizes what's going on, because it's not no marijuana regulated marijuana. We have a situation now on the ground where we have people getting marijuana whenever, however, and with every degree of potency and purity that they want.
Right.
That's the default. And to simply say that default is acceptable because there's a flaw in this theory or program or analysis or idea, or there's a flaw here or a flaw there. The alternative is what we have now. Now, I understand that I'm in a group of people and with panelists who say, fine, let it be the way it is.
Yeah, the pros outweigh the cons of that.
But understand, as we went through, the costs of leaving it where it is.
Absolutely.
And I also happen to think when that particular governor changed their mind, I won't put a gender out, when that governor changed their mind, that governor who's quite political probably understood that politically, when we can argue whether it's 70% or 67% of the public wants something, that maybe it's politically smart to get behind it and make a proposal that was extremely, I didn't particularly agree with parts of it, but I was perfectly willing to go with it, that addressed the problem in the way that governor thought it should be addressed. And he was responding to what the people wanted. And ultimately, that's what, within certain boundaries, we try to do as legislators, is reflect what the people want. We also try to exercise our own judgment too, so there's a balancing thing. But understand the argument of leaving things the way they are has all of those associated harms, which we already talked
Can I
about.
just 30-second reply that? Sorry, Amy, if I can. Quickly, number one, just on those 2 points is very important. What I'm saying is that, yes, the pros of keeping it the way they are outweigh the cons. There are cons with every public policy, but I'd rather you drive 8 miles, if you don't mind, to drive 8 miles. I know gas is expensive, but to Brattleboro, than turn your ski resorts into a weed haven, and a dangerous one, actually. I would rather you drive to Massachusetts, let them get the couple bucks, because then you don't have to pay for the costs of which are outweigh the revenue for the negatives that happen here. So that's my argument. And the second thing about the public opinion, that you go.
New Hampshire, that Vermont ski industry resorts are weed factories?
Vermont does. I don't know, but I don't know if you've been to Colorado versus Utah, and you can go and check it out, do a comparison yourself. I don't know if Vermont does as well. But let me say the second issue you mentioned very quickly about public support. Public support might be 70% when you do a question, and we can put even if that's correct, even if we say that's truly what people believe, which I don't think that is. You could say it's a mile wide, but it's an inch deep. When you ask, whether it's New Hampshire, California, Colorado, what are your top 15 issues that you care about? Marijuana isn't even in the solar system of those issues. This is not a super motivating issue for anything, but especially for voting. This is not an issue that moves voters, even young voters, and we've seen that in a lot of states. This is why President Trump in 2024 put his name a little bit reluctantly at the very end, but there were business interests, I have to say. That's why he did it. But behind the Florida ballot initiative said, well, you know what, at the end of the day, I'll be in favor of that legalization initiative because of the popularity. It ended up failing. It was not moving people to the polls. It did not change the way people were going to vote, and maybe some people, but not in a way that was significant. And so I would just say to the legislators that are, and also our former governors and others that look at this only from a political point of view, this is not necessarily gaining you. It's not like, someone who doesn't like Chris Nunu's policies on whatever is going to say, you know what, but I don't like what he says on immigration. I don't like what he says on taxes. I don't like what he says. But you know what, because he's come out for a mild legalization proposal, I'm going to vote for him. We don't see that with marijuana.
Yeah, but you can't ignore the fact that state after state after state have adopted legalization. It's because people in those states have wanted legalization, and when you're up to 37 or 38, or what the number of states are, you can't say that people don't care about it as an issue.
The 7 out of the last 10 states have voted against it, and Massachusetts is now considering a ballot initiative to repeal the sales part of their legalization because it has not been going well. So I think there's some buyer's remorse. That's all.
Okay, so Amy, getting back to the original question, are there states that are doing things to mitigate costs that bear watching, since we may well legalize it here?
I would say no. I mean, really, honestly, to this point, the states that have legalized, and to Dr. Sabet's point, they all have said, but we're going to be able to do it better. Literally, and I've sat in so many meetings with Massachusetts. We're going to be the leader. We're going to be, everyone's going to be watching us. Let me tell you, things are not going well, right? If you really look at you talk about the costs, right? The costs of leaving things the way that they are right now here compared to the costs in Massachusetts, right? The costs on the ground. You talk about the tax dollars. Well, let me ask you, what is the cost? Would it be worth it to you if a family member developed psychosis in your home? Day to day, you're living with someone who's having, and often parents are saying, persecutory delusions that are targeted towards them. So your child is now looking at you like you're the enemy. You're trying to harm them, right? What is the cost of that? To me, you can't put a price on that. That's worth no amount of tax dollars, right? And I'll keep coming back to this point. I will die on this hill for these parents, because there is literally, I have 3 children. There is no amount of money that I think anyone should be okay with to basically sell out our mental health.
All right. Thank you.
So let me just
30 seconds.
just briefly
30
ask,
seconds, Paul.
30 seconds.
Yep.
Let me briefly ask.
So we can move on.
If you had a family member that had a gambling addiction, would you then be in favor of gambling prohibition for everyone?
I'm going to be honest with you, because I'm a purist, and because Bertha Madras was my mentor and good friend. I do believe that we need to fight addiction in all of its forms to the very best of our ability.
That's a yes?
I haven't looked at gambling policy, so I actually don't know the gambling policy models the way that I know cannabis policy. So.
Okay. Representative Berch, this seems appropriate on a college campus. Can legislation limiting access to those under 21 be enforced any better than on college campuses where students are able to buy wine and liquor even though they're underage?
No.
And shouldn't that be a concern in terms of how do you deal with that?
How do we deal with it is the same way we've been talking about the whole time. So right now, even in high school, 18% of high school students use marijuana on a regular basis. At the 18 to 25 bracket, 45% said they used marijuana at least once during the past year. So the question is, what do you do? As in most things, start with education. Start with resources. If somebody feels they have a problem and this works for gambling too, if people have a problem, they have an immediate place they can go to and get counseling, get advice, and the like. The education portion. Driving it underground for any kind of mental health problem or other, stigmatizing it, criminalizing it, and the like, driving it underground, in my opinion, is absolutely the worst public response you can do.
Dr.
I mean, unless we had no age limits, you're always going to drive something underground. I mean, and in these legalized states, the underground market is thriving. California has a much bigger black market for marijuana than they did before legalization. And actually, gambling, we see this too. When gambling is legalized, the underground market for gambling thrives. Why? Because you've normalized it in society, you've introduced it and made it okay, number one. Number two, there's economics behind it. So in legalized states, and somewhere like California, where they're saying they're trying to be responsible and say, well, we're going to get tax revenue and we're going to pay for the problems, and we're going to pay for things. So they raise the taxes on it, and then the underground market is there to say, great, we don't have taxes, and we don't care about age limits, so or permits, or opening hours, or or any rules. So why would they go away? It's not like there's been that much increased law enforcement. In fact, the smartest argument for legalization, you would need to double the amount of law enforcement if you wanted to legalize, not get rid of law enforcement. Because you would have to try and make anything work, you would actually have to enforce against the bad actors. This is why this idea of alcohol, when you look at alcohol prohibition, which again was decriminalization, it was not use prohibition. But when you look at that, one of the reasons it failed, other than, again, you could not legislate something that 80% of people were doing regularly, was because there was very little enforcement. Enforcement was sporadic. It was, I mean, there was not coordinated, there was really no coordinated enforcement for it. And so if you actually want to legalize something, we've seen the underground market. So you're going to have that criminal element, and as long as you have any age limit, which you should, you will have that underground part of it. And this is why the Chinese, Russians, and others are in legalized state. They're not in Mississippi. They're not in Alabama. They're in Massachusetts, Oklahoma, which essentially has de facto legalization. They're in Maine. They are taking advantage of the structures that we think in our good wisdom in a state we can set up perfectly, and we don't need the federal government. We can do it ourselves. And we're doing it, but we're doing a terrible job at it.
But if you have, let's say, full prohibition everywhere,
Sure.
then people will still use marijuana.
Yes, of course.
They will get their marijuana
Sure.
100%
Yes.
from illegal sources.
Right. Yes, correct.
When you have a regulated system of legal marijuana,
Yeah.
a certain percentage, I
Yeah.
would only speculate,
Yeah.
will get their marijuana from legal sources.
That's right.
Just like people get their alcohol from state liquor stores, there's still moonshiners around
Sure,
and the
but-
like, or people who home brew and the like, and portion will do that. But certainly a portion of people getting it legally is better than 100% of people getting it illegally.
Actually, it's not. I would argue I'd rather have 5% of people getting marijuana illegally, which, by the way, illegally in this country for black market marijuana usually means from a friend or family member and not in a violent form. It's not, but 5 to 7% of people, then 25% of people using marijuana, half of which are legal, half of which are illegal. It is a trade-off, but I'd rather have 5% overall use, because prohibition, I don't love that word, but you keep using it, but prohibition, what it does do, and this is not controversial, is it artificially raises the price of a drug that's very easy to grow. Marijuana, very different than home brewing beer and wine. It's so easy to grow marijuana. It's, again, why they call it weed. It's very easy to hide. It doesn't have it's very, very different than alcohol growing. But marijuana, well, I lost my train of thought. But basically, what I was trying to say is that it's very easy to do that, and so I'd rather have that than the 20% of people overall, using it.
Amy, you've got teenage kids, so you're living in this
Oh,
world. I mean,
sure am.
if we legalize it here in this state, will some young people not be interested in experimenting with marijuana since it's no longer verboten? If you know what I mean.
If it's not taboo, they're
Right.
not going to want it. That isn't typically the way that we know from prevention that substance use in particular works. We do know that when you legalize, you bring really what you're doing is bring more high THC products into your communities. The data shows that communities with more restrictive policies, so where there are none or fewer dispensaries, there's less use. And so to that point, I mean, that's what the science is showing, right? And we know that it was the majority of communities in Colorado that opted out of having marijuana in their
In every
community.
state that's legalized, not
Right.
just Colorado.
Yeah.
Are you
On the local
distinguishing-
level, people don't want it.
You're distinguishing small rural counties when you say more versus urban areas that want it?
No.
You're talking about number of people?
Total of communities.
Communities.
Yes.
Well, sure. You could have 3 urban areas
that's true.
with 90% of the population
That's true.
and
That
200
is true.
communities.
No, Denver
So adding
definitely wants it.
communities
Yeah.
doesn't.
Yeah, no, it is
That's
true.
just fake
But
stuff.
It's when people go to the polls,
Communities.
whether they're in Denver or
Okay.
wherever.
Well, the science does show more restrictive policies are associated with lower
yeah,
use. I will tell you, there's 8 million people in the United States. I think the most recent data show with cannabis use disorder, right? And we know that we've got more heavy daily use happening and more use among our 18 to 25-year-olds. So yes, we absolutely want to reduce youth use. We are also very concerned about our 18 to 25-year-olds. So I didn't want to forget about that population, right? Because some of those individuals are under 21, and they are also at greatest risk for major mental illness. So I know if there's one thing you leave here today, I would like you to go and tell people about the mental health risks that come with today's high THC products. That's my one goal of today.
Yep, sure.
We have about 4 minutes left,
Okay,
so maybe one question with a quick 1-minute round.
sure, that sounds good.
Fire.
You know, let's start with you, Dr. Sabet. Many people who support legalization want New Hampshire's sale to promote New Hampshire farmers and small businesses. Is that a feasible goal, or is it inevitable big corporate marijuana, once it enters the state, will dominate the market?
Well, I'm sorry to break it to you. New Hampshire would be a terrible place to grow marijuana from your beautiful weather today. But if marijuana is legalized nationally, you're going to be ordering it on Amazon from Jeff Bezos and the top 5 people, corporate entities in this country, and you're going to be buying it from either the Golden Triangle in California or Kentucky. And you're not going to be buying it from New Hampshire farmers. We're not going to be having small businesses. We're not going to have people in the Bronx who were served in prison and got out, and now we're going to give them a chance, and we're going to give them a $2 million loan so they could lose $5 million on a bad business. None of that is going to happen because of the economics of this very easy-to-grow plant. And what I was saying about prohibition is that there are negatives with prohibition, there's no doubt, but it artificially increases it because it increases the risk. I mean, crack costs a nickel of production. Now with $1, probably 2 cents to make. The reason it costs more than 2 cents if you want to buy a hit of crack is because prohibition artificially raises the price because we have made it illegal and risky to transport it, grow it, etc. I think that's a good thing. We want to make it risky. That's a good part of prohibition. But again, if you did it, the farmers have no chance. I'm not saying you're bad farmers, you're great farmers, but when it comes to marijuana, 0 chance.
Representative Berch, as you know, the legislation that Governor Sununu supported tried to limit the number to prevent cross-pollination. In other words, not let a corporation manufacture, sell, cultivate all at the same time. Can that work? And can it support farmers in this state if we legalize it?
Yeah, so as I said, I dropped by the dispensary in Brattleboro and asked them, where's your pot from?
Oh, yeah.
And all their pots grown by Vermont farmers. I went to the dispensary in Massachusetts and got the same answer. It's farmers in Massachusetts are producing their pot. I see no reason why legislation, if we're talking about how to regulate, which I hope everybody here would take part in, I see no reason why those kind of concepts can't be discussed and the like, and whether that means state regulation, state sale like alcohol, or state supervision, and have a provision in the state law saying companies that sell it or dispensaries that sell it must obtain their product from in-state farmers and the like. So those are very handleable problems. And that's where I think the discussion needs to be.
Amy, what have you seen in Massachusetts,
Yeah,
for example?
in
where-
Massachusetts, there is a lot of conversation around this, right? And we have really, craft cultivation, really looking at boosting up our farmers. I can also say that there's been a lot of news articles about how those farmers are struggling, right? And in theory, it sounds great, but the reality is that they're struggling. And I think part of that is the big corporations are at the State House lobbying nonstop. So the majority, I work in public health, we've tried to pass public health bills to try to mitigate some of the harms that we're seeing. We're having no luck with that. But what is happening is the industry is in there lobbying, and so we're seeing a lot of bills that are industry favorable come through. And that is what the reality of what happens.
All right, sounds good. Thanks very much. I hope you'll
Thanks,
give
everybody.
a round of applause to this fine panel. Thank you.
We could be a traveling road show.
We want to thank you all for coming today. We want to thank our panelists, and we would like to thank St. A's. A reminder that Dr. Sabet's book is still available for purchase. If you Students get a free copy. How about that? At the table over here. And I just want to re-emphasize Dr. Turncliff's goal for today. All of you in the room have the power to go out and share what we learned today, whatever side of the argument you are on. Prevention has very little funding compared to the industry that's trying to promote this product, so your voice is vitally important, and we thank you for being here today. Thanks. And there's lots of snacks.